Every year, over 17 million people die from heart disease. That's a huge number, and it makes heart disease the #1 cause of death in the world. But here's the surprising part. Most heart problems are actually preventable. In this video, I'll walk you through what cardiovascular disease is, what causes it, the warning signs you should never ignore, and most importantly, what you can do today to protect your heart. So what exactly is cardiovascular disease, or CVD? Think of it as an umbrella term for problems that affect the heart and blood vessels. One of the most common types of heart disease is coronary artery disease. That's when the arteries that supply blood to your heart become narrow or blocked. When that happens, the heart doesn't get enough oxygen, which can eventually lead to a heart attack. Then there's stroke, which is kind of like a heart attack, but in the brain. It happens when the blood supply to part of the brain is cut off, usually due to a clot or a burst blood vessel. Heart failure is another big one. And no, it doesn't mean the heart stops working completely. It just means the heart isn't pumping blood as well as it should, so the body doesn't get the oxygen it needs. You might also hear about arrhythmias. That's the medical term for an irregular heartbeat. Your heart might beat too fast, too slow, or just out of rhythm. And finally, there's peripheral artery disease. That's when blood flow to the arms or legs is reduced, often because of clogged arteries, which can cause pain or numbness, especially when walking. Now imagine your heart and blood vessels like a road system. When the roads are clear, traffic, in this case blood, flows smoothly. But when there's a traffic jam or a blocked road, everything slows down or stops completely. That's what happens in heart disease. What then causes heart disease? Most heart problems begin with something called plaque, which is a buildup of fat, cholesterol, and other substances inside the arteries. Over time, this narrows the blood vessels and blocks the flow of oxygen-rich blood to the heart and brain. Here are some of the major risk factors that lead to CVD. High blood pressure, high cholesterol, smoking, diabetes, obesity, lack of exercise, unhealthy diet, and chronic stress. Quick fact, people with diabetes are 2 to 4 times more likely to develop heart disease. Now let's talk about the warning signs you should never ignore. Here's the thing. Heart disease doesn't usually hit all at once. It builds up slowly over time, often without you even realizing it. That's what makes it tricky. But your body does send signals, and it's important to pay attention to them. Some of the common signs to look out for include chest pain or tightness, especially during activity or stress, shortness of breath, pain or discomfort in the neck, jaw, arms, or back, feeling unusually tired or dizzy, swollen legs, ankles, or feet, a heartbeat that feels too fast, too slow, or just off. These might seem small at first, but they can be early signs that something isn't right with your heart. So don't ignore them, especially if they keep happening. It's always better to get checked early than to wait for something serious to happen. How can you protect your heart? Now for the good news. Up to 80% of premature heart disease and stroke can be prevented just by living healthier. Here are some easy ways to start. Eat more heart-friendly foods like fruits, vegetables, whole grains, lean proteins, and healthy fats. Cut down on salt, sugar, red meat, and processed foods. Move your body and aim for at least 30 minutes of exercise, 5 days a week. Quit smoking. Find healthy ways to manage stress, like meditation, deep breathing, or talking to someone. And don't skip your regular checkups. Keep an eye on your blood pressure and cholesterol. Now let's quickly talk about treatment options. If you've already been diagnosed with heart disease, don't panic because it can be managed. Depending on your condition, your doctor might recommend medications like pills to lower your blood pressure, statins to manage cholesterol, or blood thinners to help prevent clots. They'll probably also suggest some lifestyle changes, like the ones we talked about earlier. Eating better, moving more, managing stress, and quitting smoking. Your heart works non-stop just to keep you alive, so the least you can do is take better care of it. If you found this video helpful, go ahead and give it a thumbs up, hit subscribe, and share it with someone you care about. Because honestly, just knowing the signs could save a life. Thanks so much for watching, and as always, take care of your heart.